receiving questions from the foreign press who are there on site, as well as those through online group chat. There will be simultaneous English interpretation. Just to brief you on current coronavirus situation here in South Korea, the country reported 60 new confirmed cases of COVID-19 on Friday. Of those, 39 were cases from overseas and 21 domestic infections. South Korea is actually on alert as imported cases of COVID-19 has recently been outnumbering local infections, being over twofold or threefold. To stem a further rise in imported cases, South Korea now requires arrivals from 4 high-risk nations, Bangladesh, Pakistan, Kazakhstan, and Kyrgyzstan, to submit a certificate showing they're not infected with COVID-19. Starting next week, 2 more countries will be added to the list, though they've not been let know due to diplomatic reasons, but they're highly believed to be Uzbekistan and the Philippines. Also, to control local infections, the country introduced a 3-tier social distancing scheme that changes the intensity of virus prevention guidelines in accordance with the seriousness of the outbreak. The country itself is currently at the lowest level of 1, but some local governments have raised their levels. For the greater Seoul area, if the daily tally hits 40 or above on average for a 1-week period, it can also raise the social distancing level. So that is how the coronavirus situation is here in South Korea. And we're getting the live footage of the site. Let's cut over to the press briefing as it's just about to start.
시작하도록 하겠습니다.
We would like to begin the press
네,
briefing.
안녕하십니까.
Good afternoon.
언론 대응 팀장입니다.
I'm the PR director at the Central Disease Control Headquarters. I would like to now begin the press briefing. And today at the briefing, we are joined by Deputy Director General of the CDC Headquarters, Kwon Jun-wook, who is the PR President of the National Institute of Health, and also the PR unit head Son Young-rae, who is a spokesperson of the Ministry of Health and Welfare. And we're also joined by Go Do-kyung, who is the Immigration Management Unit Head and Director General for the Welfare Policy. Now I would like to listen firstly to the briefing from Dr. Kwon Jun-wook, and there will be a presentation by Mr. Son Young-rae afterwards. We will receive questions from the media at the Q&A session afterwards. Now first we'd like to ask Dr. Kwon Jun-wook to begin his presentation.
Good afternoon. I will speak in English only, my presentation briefing. And ladies and gentlemen, as the director of the Korean National Institute of Health, it is my pleasure to share the updates on the Republic of Korea's COVID-19 journey and response efforts with the foreign media correspondents. As we approach the 6-month mark since the first COVID-19 case in Korea. Currently, the global coronavirus pandemic situation seems to be worsening, as many places, such as United States, South America, India, and Japan, are seeing a sharp resurgence of infections, leading to concern that another big wave of the pandemic may be beginning. What these countries experiencing a second surge in transmissions seem to have in common is that they initially took on strong social distancing or lockdown measures in response to the initial surge. But once the rise in cases slowed down, began to ease the restrictions as they transitioned to a new approach of balancing infection control and economic recovery. On July 12, a record high 230,000 new cases were reported worldwide. At this point, no country can predict when or how bad the peak of this pandemic will be. 6 months after the first confirmed case was found within its borders, Korea is now facing a similar challenge once again. Imported cases from abroad account for most of the new infections, and the infections in the community continue to occur at a relatively smaller scale. Looking back on the last 6 months, we see that there were 2 major turning points in Korea's COVID-19. In last mid-February, there was an explosive surge of infections, mostly concentrated in a particular religious group and a particular region of the country. The outbreak was eventually contained thanks to the public's overwhelming and proactive participation in social distancing precautions, and we began carefully easing the guidelines to begin to restore people's livelihoods. However, in early May, there was another massive outbreak that began with a nightlife venue in Seoul and soon spread to nearby regions. Although the surge was also eventually contained, the chains of transmission tracing back to this event have continued on to this date, through transmissions occurring in closed, crowded, and close contact spaces. Nevertheless, domestic cases seem to be in gradual decline and under control. At the Korean CDC headquarters, we believe this to be a result of the hard work and organic collaboration between the public, the healthcare professionals, and the government, as each party faithfully played its role in the collective response. The government took actions to manage the importance of cases from abroad and to contain transmissions in the community, with measures such as the special entry procedure for incoming international travelers, extensive testing, timely epidemiological investigations, and management of contacts. And the timely, accurate, and transparent communication of this process with the public helped build trust and solidarity between government and the people. The collective responsible actions of the public was a key driving force behind the strength of the Korea's efforts to contain the outbreak. Surveys show that since last February to the present day, 80 to 90% of the Korean people have continued to voluntarily adhere to the social distancing guidelines, such as avoiding social gatherings and crowded public places. This resilience of our people is what made it possible to hold a successful general election in last April and carefully reopen schools for in-person classes for our children and adolescents. And of course, the most important piece in the puzzle was the selfless dedication and hard work of healthcare professionals and scientists whose roles in the containment effort have been indispensable. In summary, I believe that the following 10 factors have contributed to the success of the Korea's responses to COVID-19. Number one, effective management of imported cases from abroad through implementation of special entry procedures and post-entry management. Two, effective treatment and isolation of patients at healthcare facilities and residential treatment centers. Three, early actions taken to develop PCR diagnosis tools and expand the testing capacity. Four, through contact tracing and epidemiological investigation and disclosure of relevant information to the public. Five, systematic and accessible testing through screening clinics nationwide. Six, establishment of a public mask supply system. Seven, implementation of the distancing in daily life system to safely resume social activities such as the general election and the school reopening while maintaining infection control measures. 8. The hard work and selfless dedication of the healthcare workers. 9. Governance of cooperation and sustainability with daily briefings and meetings led by the Prime Minister. Lastly, 10. Cooperation and solidarity between private sector, public sector, industry, and academia in research and development of therapeutics and vaccines. Based on what we know about the characteristics of the virus and global and domestic developments, it is our understanding that there is no secret weapon in the fight against COVID-19. The only way for humanity to move forward is to change and adapt our practices to the new reality as we learn how to live safely with the virus in our world. We ask our people to walk this journey together by making infection prevention habits such as mask wearing and personal hygiene a regular part of their everyday life. The Korean government will do its best to improve the environment and the culture of each corner of our society to ensure that these new habits can be integrated into our new routines. Together, we can help accelerate the elimination of COVID-19. For more detailed information, please refer to the materials already provided. I appreciate.
네. 네, 다음으로 손영래
We will be hearing from Mr. Young-rae, who is from the Ministry of Welfare and Health. Yes, I think we have to switch to my presentation. Yes, I am Young-rae, who is in charge of the strategic planning related with COVID-19 at the Ministry of Welfare and Health. Today, I have prepared a presentation on the Korea distancing in daily life concept. As you know, COVID-19 is a situation that will be continuing for quite some time. And so in that context, I want to introduce to you Korea's distancing in daily life concept, which aims to continue and resume normal everyday and economic activities while containing COVID-19. So this has been prepared as a system of allowing as much as possible normal economic and social activities while effectively containing the spread of COVID-19, assuming that the pandemic will continue for some time. So please, let's start with the presentation. First of all, Korean social distancing consists of 3 stages. Level 1, and then we have escalations to level 2 and 3. Level 1, which is called distancing in daily life, allows all everyday economic and social activities while practicing the safety and prevention guidelines. Now, when the virus starts to spread beyond a level supportable by routine medical systems, then we will escalate to level 2. And under level 2, indoor gatherings of 50 persons or more, outdoor gatherings of 100 persons or more are restricted. Also, operation of high-risk facilities such as clubs or bars, as well as public facilities operated by governments, are restricted. Also, other public facilities would have a restriction on the number of visitors. The next escalation level will be level 3. Here, non-essential activities are to be refrained, including use of public facilities and gatherings. Gatherings of more than 10 people are prohibited under level 3. Also, for public facilities, operation of not only high-risk but also mid-risk facilities are suspended, and operating hours are limited to 9 p.m. So we transition to different levels based on a weekly basis. We look at the risk level of the previous 2 weeks based on several factors, such as whether the confirmed cases per day were 50 or less, whether the ratio of cases of unidentified contagion is 5% or less, as well as the size and number of outbreak clusters and the R value. This distancing level can be adjusted nationwide or for specific regions. We also have, for example, regional criteria to assist the decision of local governments. Now, level 1, which is distancing in daily life, this is the concept. This is normal life. As explained, under this level 2 distancing in daily life, normal daily activities, economic activities are permitted while maintaining prevention mechanisms. To do this, we need to have 3 elements interoperating organically to keep COVID-19 at bay. First of all, the public needs to practice basic hygiene guidelines and distancing as part of their daily routine. This will slow down any potential spread and minimize the scope of potential transmission. The second factor is a comprehensive monitoring system. It has to be in place so that we are able to detect any transmission of the virus as soon as possible for the right intervention. This is done by not only medical facilities but also high-risk groups and facilities. The third element is tracking confirmed cases quickly with precision and testing so that we are able to identify people that would have been exposed to the virus. This is aimed to prevent additional transmission and to root out and cut off the transmission chain. When the 3 elements work together effectively and organically, we are able to resume daily social and economic activities while effectively containing COVID-19. So, let's look into detail each of these factors. The first is actually the public participation. The public needs to learn and practice the basic guidelines, not only as individuals, but also as part of a larger community. For example, there are 5 basic guidelines: staying home if you feel sick, or maintaining 1 to 2 meters, washing hands, and correct coughing etiquettes. These are the basic 5 guidelines. And then there are 4 supplementary guidelines, including wearing masks. These are not compulsory guidelines. It is a recommendation and a guideline, but I think many Koreans have taken this as part of their daily routine. Of course, these guidelines are not on their own enough to completely prevent COVID-19, but it is the public participation that is a critical factor in slowing down the transmission and to reducing the scale of potential outbreaks. Public facilities such as department stores, restaurants, gyms, and clubs are classified into high, mid, or low-risk facilities based on a risk assessment using various factors, such as the degree of closeness. If a facility is designated as high risk, both the operator and the users will be legally required to follow prevention guidelines, including keeping a visitor log, wearing masks, and practicing thorough ventilation disinfection. For example, Korea, we have 12 types of facilities, such as nightclubs, bars, and karaoke rooms, that have been designated as high risk. Of course, the list may be adjusted according to ongoing risk assessment results. As you know, recently, we have started to use a QR code-based electronic visitor log that uses the visitors' smartphones to keep track. Next is the second element of our distancing in daily life, which is the comprehensive monitoring system. As you know, Korea has been operating a very wide-scope monitoring system based on broad-scope PCR testing, including a COVID-19 specimen monitoring system. And the purpose is very simple and clear, is to identify outbreaks as quickly as possible. For example, hospitals would preemptively perform PCR tests on patients that are newly hospitalized with pneumonia symptoms or those that come into intensive care or the emergency room. Also, COVID tests can be ordered by the doctor if he suspects a patient may be infected, and the testing costs in such cases will be supported by the government and will be free to the patient. Recommendations for high-risk facilities such as senior care hospitals, mental hospitals, are also that COVID tests should be taken if there are even light symptoms. Also, entire populations are tested in certain cases, such as those that are enlisting to the military or students. And so these are cases where we do a large-scale testing, and in these cases, for efficiency, we use a pooling technique where specimens from 5 subjects are tested together.
Next slide is about the third element of the distancing in daily life, which is contact tracing through a quick and sophisticated epidemiological investigation. I'm sure you've heard a lot about Korea's epidemiological investigation, so I'll be very brief here. Korea uses IC technology to quickly and precisely conduct epidemiological investigations, which are credit card transaction records, to do mobile phone location checking, go through QR code-based entry log at the public use facilities, and analyze CCTV footage. As we develop new ways to utilize ICT, our investigations capability is being enhanced, speeding up. It took 3 to 4 days in February, but now we are able to do most of the new patients moving routes and contacts tracing within a day. And we are able to identify the contacts. And with extensive and aggressive PCR testing, we conduct them to people who have been contacted. And at the facilities that the authorities track down, and we are able to identify them at an early stage. Now I'd like to talk about the government's decision-making and cooperation system. In Korea, all government agencies are working together to realize a comprehensive response system. And as was just mentioned, we have a specialized government agency that's dedicated to infectious disease response called KCDC. With a new infectious disease, when it starts to spread, the KCDC takes on the leadership role as the control tower. The government will be reorganized into an all-out pan-government support system to assist CDC in responding to the infectious disease. Under the single body headed by the Prime Minister, the Health Ministry, which supports the mobilization of healthcare systems, such as mobilization of hospitals and medical personnel, come together with all the government agencies to form a huge pan-government body. In case of local governments, the government will create a response unit for the upper level and lower level local governments to facilitate cooperation. KCDC, the central government, and local governments hold joint meetings every morning through video conferencing. Thousands of government officials participate to make speedy decisions and share the results. Media briefings are held twice a day to provide the COVID-19 status update and to announce new major policy decisions in the most transparent manner. Lastly, I'd like to talk about the outcomes that we have achieved in distancing in daily life. First of all, without extreme lockdown measures that incur losses to the national economy and infringe on the people's freedom, Korea has effectively suppressed the spread of COVID-19. At the end of February, we experienced a large-scale outbreak related to Shincheonji religious community in Daegu City. And at this time, we imposed a strong social distancing measures. We stabilized the situation, and then in May, from early May, we found out that about 100 people were infected, mainly at the clubs in Seoul. And cluster infection of virus is found in more than 50 venues nationwide, including churches, workplaces, and nightlife facilities. However, at this time, although the confirmed cases were reported continuously, the infection size was modest with only 20 to 30 people. We did not experience a massive outbreak as we did in February and March. In particular, I note that there were no additional cases reported from many public use facilities that confirmed the patients that visited. This infection has been spreading and relaxing on a small scale and was gradually decreased to only about 10 cases in July. And this is because people adhere to the principle of distancing in daily life. We believe that it is a proof of the effectiveness of having a daily routine of distance in all living spaces. Second, we are accumulating successful outcomes of distancing in daily life. Nationwide, the parliamentary election was held successfully. School classes have resumed, and large-scale examinations participated by hundreds and thousands of people are being conducted without new confirmed cases. Through these success stories, we accumulate experience, we build confidence, and improve our compliance with the infection prevention and control guidelines in daily life. With these achievements, the public is becoming more aware of the risk in behaviors and facilities, and the government is acquiring capabilities for more detailed standards and better control. As such, distancing in daily life system is continuously being advanced. So far, I've outlined Korea's distancing in daily life system. As for Korea, as I just explained, we believe that social and economic the activities are being resumed, and we are trying to control the coronavirus outbreak. And we are now looking at substantive results being produced. But we do believe the situation is quite difficult, and trial and error is inevitable. But we do believe that this is a path that we must take, and we need to accumulate experience and knowledge. And we do believe that we need to become more confident at the way forward. And we hope that our efforts will be helpful to other countries that are struggling to harmonize social and economic activities with the infection prevention control system. Thank you.
Now we will open the floor and receive the question from the members of the Foreign Press Corps. We appreciate that you have joined us. We will also take questions from the online attendants. Why don't we first start with questions here, offline outside. Please give us your name and affiliated media before asking your question. Also, to give the opportunity to as many members of the press as possible, we would have to ask you to limit your questions to 2 per reporter. Please raise your hands if you have a question. We will take all of your questions. We'll just need to take turns. I think we will start from the front of the room. The gentleman in the blue suit.
Thank you very much. Andrew Salmon, Asia Times. 2 questions then. One question, travel restrictions. What conditions need to be met? What metrics are you looking at to relieve the travel restrictions which are currently in place? Second question, Korea has an admirably low death to infection ratio, but one thing you haven't talked about is the treatment protocols for those with serious symptoms. Could you perhaps just discuss what you're finding the most effective treatment format is for those whose health or life is endangered? Thanks.
네, 한국말로 하겠습니다.
Yes, I will answer in Korean. Your first question was about the criteria that needs to be satisfied for the travel restrictions to be released or to removed. We have conditions by country. We classify countries into risk groups according to 4 criteria. First is whether the other country has have a recent increase in new cases. So we look at the recent 4 weeks. 100,000 population, the number of new cases, if it's higher or lower than what we've seen in Korea. So that's number 1. Second is we look at the trend. So there are new cases in the other country, whether it's an increasing or declining trend. So we look at the past 4 weeks increasing or decreasing trend in the number of new cases. The third criteria that we look at is what we are seeing from the imported cases. We do have testing at the border, and so if we see a particular spike from people coming in from a particular country, that is another factor that we put into in our assessment of risk. The fourth is we do have our embassies and consulates at local countries, so we do also get information from our diplomatic missions in these countries. If we hear that, so because we do need to see whether the cases that are being reported are actually objective, correct numbers. So those are the 4 factors that we consider in assessing the risk of particular countries, and then we classify them into different risk levels, and then we restrict travel to these countries accordingly. Now, the second question was about our treatment protocol. I think we are at a fatality rate of 2.
높고 이렇게 생각할 수 있는데 물론 제가 통계를 보게 되면
2.13%. It could be high, it could be low, but I think at least we are actually higher than some countries. But we are very low compared to countries that are having an absolute large number of cases. Because when it comes to Korea, patients with light symptoms are treated mainly in these residential treatment centers so that we are able to focus our medical resources on the serious cases, on preservation as well as symptomatic treatment. But also from early July, we have started the active program under the US NIH. So we have been using since early July the remdesivir, which is an Ebola treatment drug that we have started to use from early July. Also, there's the convalescent plasma treatment. The plasma treatment that is based on the plasma of people that have already suffered the disease. We have been collecting plasma from patients. Those are 20 cases that we have collected plasma from people who have already suffered. And so we have ECMO treatment for really serious cases. So we have not only the symptomatic treatment, but other special treatment that we have been using. Also, one of the reasons I think we have a lower fatality rate is it's the denominator of that number, the number of total cases. Because we are testing a large number of cases, we are able to detect cases relatively early in the progress, and I think that is why we have a better outcome in terms of our treatment. The early detection, I think, is a factor in our better outcome. Also, when we were going through our first wave, we had an concentrated outbreak around a religious group, which had actually a proportionally large percentage of people in their 20s and 30s. So we actually had a very young demographic in our patient group, which also helps have a better outcome. So there are some epidemiological, and what you have asked was about treatment. We have, of course, the routine care. We also have intensive care. And lastly, I would like to add, even though you would know better, we have universal health care and health insurance in Korea. So everyone in Korea has full access to medical treatment with very low co-pay burden. So people, when they feel a little sick, they are very eager to find medical care. So they get good medical care early on.
Just regarding the lifting the travel restrictions, what are your conditions for lifting the 2-week quarantine period?
네. 예, 우리는 지금 여행과 관련해서 국내에 들어오는
To the travel restrictions for the domestic nationals as well as foreigners, we require that they are quarantined, home quarantined for 14 days. If they do not have a place of their own, we ask them to stay at a designated facility. And while they are in a quarantine, they need to undergo the RT-PCR on the coronavirus. And if they're confirmed, then they will be hospitalized as a patient. But if you do not get a positive result, you will still be required to stay inside for 14 days. You see that if you look at the data, it's more than 40% in the United States for other countries. You see that when testing becomes active, you see that asymptomatic spread comes, it becomes more rampant. You see that more come from the asymptomatic patients, and therefore we are currently conducting the policy, implementing this policy. We are paying attention to the asymptomatic patients. For symptomatic patients, we ensure that we'll be able to quarantine, at the quarantine checkup, we'll be able to identify them. So I'm assuming that you're asking about that Korean situation, about asking the question on the 14 days, about the home quarantine and being quarantined in the facilities. But I would like to say that after 14 days, we do not not require that they undergo another PCR. For your reference, I would like to, well, that is the current situation.
추가 답변 없으시면 추가 답변.
You would like
네, 질문. 네. 아까 손을 들었던
if you'd like to
기자님
pose a
먼저
question,
질문하고
I'd like to
그다음에
ask
질문
the
받도록 하겠습니다.
reporter who raised up the hand first. So, gentleman at the center, and then you on the right, and then towards this side. So please go ahead.
Thanks, Andres Sanchez from the Spanish news agency. Two questions for Mr. Kwon Jong-wook. First one would be, I know KCDC has actually already talked about human resources capacity when it comes to epidemiological investigation, but mainly the data that I've seen relates to high-ranking officials and institutions potentially involved in these investigations. I would like to know if you do have an estimate when it comes to human resources, how many people, what's Korea's capacity in the number of people involved in epidemiological investigation? Second question would be if you could comment a little on the results of the antibody test that you talked about on 4 days ago. A little awkward, those results where only one person came out infected out of more than 3,000 individuals, and also if KCDC is planning to conduct more of these tests in the future. Thanks.
예, 두 가지 질문을 주셨습니다.
So I received two questions. The first question I received through interpretation, I believe that was about epidemiological investigations, about the context in epidemiological investigation. You asked me about the number of the personnel involved. You're asking whether we have a sufficient number in place right now. As of now, the KCDC is awaiting a bill to be passed at the National Assembly, and we are about to be promoted to a higher level within the government organizations. And one of the essential elements in us being upgraded is that we expand on the personnel that will be in charge of the epidemiological investigations. For the epidemiological investigation service in the United States, their role is essential within the organization, the equivalent organization. We have less than 100 right now, and we are trying to expand the number with active recruitment efforts. But we believe that if we are to expand on the core personnel for the epidemiological investigations, we need to be able to increase the salary level, and we need to be able to present a clear vision for those who want to join us. We want to make sure that we recruit very talented officials, personnel in the future. And we also believe it's very important that the regional autonomous bodies, that there are personnel placed in those local autonomous bodies. They need to be trained sufficiently. They need to be deployed in enough sufficient numbers so that they will be able to take on the investigation actions on their own. And as we get promoted to a higher level organization in the future, we believe that we would be entitled to come up with an organization to provide support for about 5 regional offices. And with these offices being established, we'll be able to provide adequate support to the personnel at the local autonomous bodies. We'll be able to help them to recruit and train the investigators. And therefore, the capability, personnel's capability will be further strengthened in the future. On the next question about the antibody, the test outcome, I understand that the reporter, supposedly the question that comes from Spain, and we pay a lot of attention to what's going on in Spain, because in Spain, many countries have conducted the test, but I think Spain showed the largest size with 80,000. And I think Spain has a very significant test being conducted, and the number is quite representative by looking at the size of the population. I believe that the outcome was about 5.5%, and for a specific region, the number was in 2 digits. As for the Korea, I understand in Spain it was just a simple antibody test, but in Korea, Korea, what we did was conducted to come up with the herd immunity. We wanted to identify the herd immunity within the regions. So ultimately, what we wanted to find was neutralizing antibody. As for Korea, at the screening stage, we used the regular antibody kit, and we used the PRNT, which is to confirm the number, a neutralizing number. And we need to carry on the 3 more test sessions, and for 1,555 cases, we did not identify a single one. And for the southwest part of Seoul, I'm not sure that many of you would remember, but sometime in mid-March, there was a massive outbreak at the Kuro Call Center. And then in the Bucheon and its vicinities, we have seen some outbreak as well. So we do expect to see some the antibody outcome. There are about 1,500 the hospital patients that's been checked, and we found out a PRNT, the outcome of the 1,500 conducted. The 1,555 tests conducted relates to the nutrition and health checkup that we conduct on an annual basis, and we have a sample size of 11,000 ones, and we have about 70% samples collected from there. We're going to carry out 3 more sessions as well, and we're going to soon see the outcome of the tests conducted in the Daegu region as well. And we will be able to find out more significant results as time goes by. I understand that Scotland is another country that looks at the neutralizing numbers, and Scotland is about 0.6% in the outcome. So I don't think it's appropriate that we overemphasize the number that we have right now. But the authorities now believe that for the regional level, the immunity, the number is going to be quite low. And if you look at all the number of the confirmed cases, there are the patients that come out from the regional communities, and there's a likelihood that the numbers would not be quite significantly different, will not be significant different. And also, if there's a very significant outbreak, and we need to pay more attention to the social distancing. Social distancing should be prioritized over the regional communities, regional governments efforts for the response measures. And nextly, we believe that for the new military recruits, we need to carry out the PRNT testing, and at the Daegu region, with a special focus on the Daegu region, we are currently conducting an intensive test, and the outcome will soon be announced.
If I may follow up on that, you've I think asked about the personnel that are involved in the epidemiological research. Yes, the personnel is important, but also the support system is important in raising the effectiveness of the people that we have. For example, in Korea, we have been actively leveraging ICT technology, for example, using smartphone, location tracking, or credit card, and all of that has been developed into systems. We have been using that for about a couple of months, and that has made our epidemiological research much faster. So, for example, we can actually get the movement of patients largely mapped out within about an hour's time. Also, we have been introducing QR code-based visitor logs, which are also being practiced in other countries like Singapore and China. And that actually is another example of how we use IT technology for better epidemiological effective research and investigation. Also, it helps us, for example, quickly identify people that may have been potentially exposed because they were visiting the facility at the same time. Also, in addition to the epidemiological researchers and investigators, we have some police force, for example, or local government employees that support. For example, police, there are specialists that analyze closed-circuit TV video, so they are very quick in doing that. Also, local government employees have a lot of access to information to support. board. And so regardless of the absolute number of epidemiological researchers, investigators we have, all of that support system actually raises the actual
다음 질문
outcome.
받도록 하겠습니다.
We'll take the next question. Yes, please.
Thank you. Kim Gamble with Stars and Stripes. You know, recently a large number of American service members have tested positive upon arrival in South Korea. And I know that you work closely with USFK and that they have a very strong testing and quarantine process. But I wonder if you can comment, you know, given the increasing numbers recently, on your concerns about this, and whether your discussions with USFK have included them strengthening their measures, including on the front end, for example, having the soldiers being tested before they get on the plane. That's my first question. The second question is, you know, a lot of these soldiers, but also, you know, regular people are flying in on commercial flights. Have you found any evidence that people are being infected on the plane, considering that there are often people who have COVID among them? I wonder if you've seen any evidence of that. Thank you.
예, 두 가지 질문을 주셨습니다.
Oh, yes.
먼저 첫 번째로
You've asked two
말씀하신
questions.
미군과
The first
관련돼서
question is about the U.S. forces here in Korea and new soldiers arriving and testing positive. At a general level, regarding USFK,
아주 긴밀하다고
there is a very, very close collaboration. It's beyond close collaboration, almost near real-time exchange of information and cooperation between the Korean local disease control authorities and the USFK authorities. You have mentioned that there are quarantine and testing procedures. There's also SOFA procedures that are in place. And so Korean authorities have a very high regard for the USFK procedures, and we totally trust and respect those procedures. We have been testing both foreigners and Korean nationals upon their arrival, and we have them isolated and have them PCR tested within 3 days of their arrival in Korea. And according to what we have learned, USFK also practices real-time PCR testing upon their arrival here in Korea, and they also practice isolation within their bases, and then they do another real-time PCR at the end of the 14-day quarantine. That is what we know of the USFK procedure, which therefore is even stronger than what we are practicing. Unfortunately, however, it seems that because there is a transmission within the U.S. itself and it is reaching concerning levels, I think that is the reason why we are getting more number of cases within those soldiers arriving in Korea, not only in terms of the number, but also those that need treatment. So the seriousness of the cases are increasing. So we are constantly receiving information on a near real-time basis from the U.S. forces. And as you mentioned during your question, the U.S. forces are not only stationed in Korea, but they are stationed in Japan. And in that case, in Japan, I think there was a taxi driver who had entered the camp who got infected. And so it seems that there are some on-base transmission risk, which is also a critical point that we need to contain. And so I have been told that from DOD level, the U.S. has a lot of discussions going on within their military chain of command. For example, when the servicemen come into Korea from other regions, they have to spend a certain amount of time in isolation or testing before they arrive in Korea. So I have been told that there are many other measures that are being discussed at the DOD level. Indirectly, we have been told. And so to summarize my first answer, the key points is that the Korean authorities have very close collaboration and information sharing with USFK authorities. Also, the U.S. forces have been very faithfully and practicing what we recommend, and even they practice even stronger guidelines. And this connects sort of to your second question, because many of the servicemen not only ride in on military planes, but also they ride on private airlines. And so the U.S. forces are trying to recommend that their servicemen try to fly in military planes and try to avoid riding on private airlines. But we are continuously cooperating with the U.S. forces authorities. You asked about commercial airline and transmission within the airplane. In 2003, SARS, which is the same coronavirus, there was a New England Journal of Medicine article where there was a mention of an in-plane transmission case. But recently, in Korea, I don't recall any cases of transmissions happening inside the private airline or airplane. I will go back and check with my office whether there are cases that I am not aware of. But, for example, it's important for the crew, the onboard crew, to wear masks and to minimize their onboard service, to minimize contact between the crew and the passengers. Also, as you know, international airlines have a laminar flow of air, so that when people are sitting, the air flows from top to bottom and then from actually front to back. And for that, because the way the air flow is designed, we do test the front 3 rows and the back 3 rows of a confirmed case. So we actually test 7 rows of patients as a risk area. So we do testing and tracking. But this sort of ties into the first question. So right now, we don't, regardless of whether a person is a Korean national or foreigner, everyone goes into a 2-week isolation. So regardless of where they were sitting on the plane, they will be in quarantine and isolation for 2 weeks. If we do have a case, we still actually will have additional control of people that were sitting in the 7 rows and notifying the local authorities for monitoring. Now, I will, though, go back and check on cases regarding transmissions within airlines. I'm not sure if there was any article in a medical journal that I'm not aware of.
Yes, please go ahead.
Sky News.
That brings us to the end of our live coverage on the South Korean government's COVID-19 briefing for the foreign press. We will be back with our regular newscast at 5 p.m. Korea time. Until then, goodbye.